Non-alcoholic fatty liver disease is a term for a range of liver conditions that occur in individuals who do not drink a significant amount of alcohol. It basically means that there is too much fat that is being stored in the liver. It is normal for the liver to contain some fat. However, if more than 5% to 10% of the liver's weight is fat, then it is called fatty liver disease. In the United States, it is the most common form of chronic liver disease, affecting about 1/4 of the population. Fatty liver disease is typically silent and does not cause any symptoms. It is often picked up on routine blood work or on an abdominal ultrasound. This disease comes in two forms. One is simple fatty liver, and the second is fatty liver with inflammation, which is also called NASH. Of the two, NASH is more serious, and it can in some people lead to cirrhosis of the liver. When left untreated, fatty liver disease can progress to inflammation and cirrhosis. Scarring due to cirrhosis isn't reversible. If you develop cirrhosis, it also increases your risk of liver cancer and liver failure. These complications can be life-threatening. The outlook for fatty liver disease is best when treatment begins in the early stages before cirrhosis happens. Both simple fatty liver disease and NASH are more common in those individuals who are overweight or have obesity. It is also seen in those with type 2 diabetes, those who have high triglycerides, sleep apnea, and polycystic ovaries. There's no medication at this time to treat fatty liver disease. The first-line treatment is weight loss. Just a 3 to 5% weight loss can lead to improvement of this condition. In many cases, lifestyle changes can help reverse most stages of fatty liver disease. Other treatments that help are exercising at least 150 minutes per week, eating a nutrient-rich diet that's low in excess calories, saturated fat, and trans fats, limiting alcohol intake. Don't overdo over-the-counter medications like Tylenol, which work through the liver, and keep your blood sugars and triglyceride levels under control. If you're ready to improve your health with weight loss, I invite you to visit our website at healthymeweightloss.com. My team and I look forward to meet you.